Welcome back. In your morning medical news, young and middle-aged women are being diagnosed with lung cancer at higher rates than men, and many have never even smoked. While smoking does remain the biggest risk factor, lung cancer rates have risen 84% in women over 4 decades, but dropped 36% in men. Doctors say a genetic mutation could be driving that troubling trend. About 40,000 non-smokers are diagnosed every year in the U.S. Meanwhile, scientists have discovered vaping damages blood vessels within minutes, even without nicotine. The new research shows these immediate changes could trigger serious long-term health problems, from blood clots to heart attacks. It's not just the lungs either. The ingredients could cause inflammation throughout the body. Researchers say it's clear evidence e-cigarettes aren't the safe smoking alternative many thought. Findings they hope will guide future safety regulations. It is deemed an urgent global public health threat by U.S. officials. Antimicrobial resistance happens when germs no longer respond to drugs designed to kill them, making it harder, sometimes even impossible, to treat infections. Mandy Gaither has more on what you need to know and how to help prevent infections that can put you at risk.
It's a growing threat. In the U.S., more than 2.8 million antimicrobial resistant infections happen every year, killing more than 35,000 people, according to a 2019 CDC report.
It's this growing progression of antimicrobial resistance that makes it one of the greatest global health issues of modern time.
Dawn Sievert with the CDC says to fight this threat, antibiotic and antifungal prescribing and use needs to improve. The agency says families should also take steps to reduce risk and help stop the germs from spreading. Keep cuts clean and covered until healed. Take good care of chronic conditions like diabetes or heart disease. Keep hands clean and get vaccinated. The CDC says vaccines help prevent infections, including ones that are resistant.
With modern travel of people, animals, and goods, antimicrobial resistance can easily spread.
Sievert says the phenomenon also has the potential to affect anyone, regardless of age and health status, and can complicate nearly every health problem a person faces. Since advances in modern medicine depend greatly on antibiotics being effective, she says it can put certain surgeries, like cancer therapy, at risk.
Patients requiring these procedures and treatments are at significant risk for infection, but they might not be able to receive the needed care if antibiotics are not available.
The CDC says antimicrobial resistance is already affecting all regions of the world, and it's a leading cause of death globally, with the highest burden being on low and middle income countries. And a new locally controlled hospital could be coming to Chippewa Falls. The health cooperative there said it's earned a nonprofit status and completed some planning studies. Officials say the facility would offer broader care than Aspirus's planned hospital. The public can learn more on December 9th at the Heidi Center.